The National Health Service, the NHS, once the greatest healthcare provider in the world, is now sadly up against the ropes through a combination of red tape and bullshit, and a lot of its money being spent on things which don't actually impact on healthcare. Well, now several NHS trusts have introduced a new policy and have told their staff that they can be disciplined or even dismissed, because what this country really needs is less doctors and nurses, if they don't go along with this very new, very woke policy. Because even though the pushback against wokeness is in full swing throughout the private sector, because frankly we've had enough of it, the NHS is run by the government, so wokeness must be embraced and encouraged, lest a few screamy people get offended or logic and reason attempt to intervene. So NHS staff in some trusts can be sacked if they fail to use a patient's preferred fucking pronouns. Yes, the pronoun police have infiltrated the health service. And now some 999 operators, and if you're watching this from overseas, 999 is the British equivalent of 911. Some operators are having to start the call by giving the caller their pronouns. Now I'm sorry, if I'd fallen off a ladder, broken both my legs, I've got an arm missing and I'm bleeding out, I don't give two shits if that operator goes by Zzer or Bunself. Just send the ice cream van with the blue flashing lights. Or if someone turns up at accident and emergency, the emergency room in the USA, is it really necessary for the first healthcare professional who intervenes to ascertain as to whether the person who is in the process of dying goes by he, him or pup-self? Or even maybe this person is doing this TikTok bullshit where they say they're part of a system. They've got 12 different alters. Sorry, those 12 different personalities are all having the same heart attack. NHS staff, so medical professionals, have also been told they can't tell patients who use neo-pronouns, the they, them, zer, all that bullshit, that those pronouns don't really exist, which of course they don't. Also, they can't say that if a person uses they, them pronouns to apply to a single person, that is grammatically incorrect, which of course it is. And I'm sorry, if I'm being treated for a medical condition, I want to know the person treating me has a modicum of common sense. Not some weirdo who thinks men have periods and some women have dicks. And that's the point, I guess. In a medical situation, all of the made up stuff should go away. It doesn't matter if I wear a wig and refer to myself as a woman. When I go to the hospital, the doctor needs to know that I'm male. Because we can't get to the situation where a nurse will walk in to see a patient, will lift up the patient's paperwork and say, "Oh, I see you go by she, her. Well, I'm very sorry, madam. You have testicular cancer." Or the same nurse, "I see you go by he, him. Well, I'm very sorry, sir. You require a hysterectomy." Wouldn't it be better to actually just apply logic? Again, let's say a nurse walks in to see a patient. "I see your pronouns are they, them. Just to be clear, there is only one of you." Now, I would pay good money to watch a doctor working in A&E at a weekend when it's absolutely flat out just lose his or her shit at some pronoun-obsessed half-wit. For a doctor to walk up to a patient and say, "Well, we all know you're male, but you're insisting that we use she, her pronouns. Do you have any fucking idea how busy I am? How many fucking patients I've got to see today? And you're more obsessed with your pronouns than your broken fucking arm. So we will set your arm in plaster. Do not come back to this hospital. I am not the doctor you want. See a psychiatrist and get your fucking head sorted." The thinking, as it is, behind this new policy is that if patients are addressed with their preferred pronouns, their feelings won't be hurt and they'll feel more validated. Well, boo fucking who? Because if I were in hospital and someone accidentally misgenders me, I mean, first of all, their eyesight would be very bad, please don't operate on me. But I wouldn't mind being misgendered as long as they took the actual pain away. And to anyone watching this who uses they, them pronouns or neo-pronouns, you may think you're being modern and edgy and speaking your truth. But the rest of us know you are devoid of all personality and you're a narcissistic, attention-seeking wank puffin. It says a lot about the modern world that when a child is born, the midwife, nurse, doctor, whoever hands the child to the mother and tells the mother the sex of the child. But in the modern world, If the mother is extremely thick, has poor personal hygiene and green hair, she can then tell the doctor that they're wrong. As ever, thanks for watching.